Hi friends, welcome back in today's tutorial. In this video I just want to show you how you can combine Ceftriaxone together with Hydrocortisone. In this video I just want to show you how you can combine Ceftriaxone together with 200 mg of Hydrocortisone sodium for injection. So let us proceed. First, make sure you start by cleaning your hand with the disinfectant. Make sure you clean your hand first. Then what you do, make sure you don the gloves first. First, make sure you wear the gloves. Then before you start, make sure you gather all the necessary supplies that you need to perform the procedure. For instance, you need a syringe, you need an alcohol swabs, you need a 21 gauge needle, you need a 23 gauge needle, you will need a gloves for you to apply as a tourniquet, you will need a cotton wool for you to apply pressure on the area where you have given the shot. Then what you do, make sure first you start by introducing yourself to the patient and you gain consent and make sure that you explain the procedure to the patient. For instance, hi, my name is Dr. Daoud. I'm going to perform IV insertion. Are you ready?
Yes.
So you have to gain consent for you to continue. Then what you do, make sure first you start by diluting the drug. You get the syringe together with the needle. Make sure you attach the syringe into the needle. So use the 21 gauge needle for you to reconstitute the drug. Then what you do, you get the drug. First you get the Ceftriaxone. So you have to check method of administration for IV or IM use only. So you can reconstitute, you can administer by giving through intravenous or intramuscular injection. So when you want to administer the drug through intravenous route, you are supposed to dilute with 9.6 ml of sterile water for injection. When you want to administer the drug through IM, you are supposed to dilute with 3.6 ml of sterile water for injection. So make sure that you check the expiry date of the drug. So make sure that you check the expiry date of the drug. Then you open the packaging of the drug. So this is what you will find. You will get one vial containing white powder of 1 gram of Ceftriaxone, and you will get 10 ml of sterile water for injection. Then what you do, you get an alcohol swabs. Then what you do, you open the plastic vial. Make sure you clean the opening of the plastic vial with an alcohol swabs before you start withdrawing the water for injection. Then what you do, you get the syringe together with the needle. Make sure that you withdraw the sterile water for injection from the plastic vial. So make sure you withdraw all the sterile water for injection from the plastic vial. Make sure you remove any air bubble from the syringe. You put the needle back into the cap. Then what you do, you get the Ceftriaxone, you get an alcohol swabs. Then you flip off the opening of the vial. Make sure you clean the opening of the vial with an alcohol swabs at least for 20 seconds, and you allow it to dry for 30 seconds. Then what you do, you get the syringe, you remove the cap of the needle. Make sure you incorporate all the sterile water for injection into the vial. Then you release the plunger. Make sure you shake the vial together with the syringe and ensure that you transfer all the sterile water for injection into the vial. And you release the plunger. You shake the vial gently and you push the plunge again incorporating all the sterile water for injection to the vial. Then you remove the needle from the vial. Then what you do, make sure you shake the vial gently, ensuring that all the drug has completely dissolved. You get an alcohol swabs. You get the vial containing the white body of hydrocortisone sodium for injection. Make sure you flip off the opening of the vial. Then you clean with an alcohol swabs the opening of the vial. Then what you do, you withdraw 2 ml of the diluent of the ceftriaxone. Then you can mix with the hydrocortisone. So you remove the cap of the needle. Then you withdraw 2 ml of the drug. Then you get the vial containing the white body of hydrocortisone sodium for injection. You inject it into the vial. Then you transfer all the drug into the vial containing the white body of hydrocortisone. Make sure you shake the vial gently. Again, you withdraw 2 ml of the diluent of ceftriaxone. You withdraw 2 ml of ceftriaxone. Then again, you reconstitute with the second vial of hydrocortisone. You get the second vial of hydrocortisone. You get an alcohol swabs. Make sure you clean the opening of the vial with an alcohol swabs. Then you allow it to dry for some time. You get the 2 ml of ceftriaxone diluent of the drug. Then you reconstitute it with the vial containing the white body of hydrocortisone sodium for injection. Make sure you shake the vial gently, ensuring that the drug has been completely dissolved. Then what you do, you put the cap into the syringe. You start now combining all the drug in one syringe. So first what you do, you start withdrawing the drug from the vial containing the hydrocortisone sodium for injection. You get the second vial. Then you withdraw the 2 ml of the diluent. You get the vial containing the diluent of ceftriaxone. Then you withdraw from the vial. So when you combine the drug in one syringe, they will have the same concentration without using another sterile water for injection. So make sure when you want to combine the drug, only use one sterile for injection of the ceftriaxone together with the hydrocortisone. What I am saying is, when you want to combine the drug, make sure you only use the solution of the 1 gram of ceftriaxone. Then you start reconstituting with the 2 vials of the hydrocortisone. So they will have, both the drug will have the same concentration. So the 1 gram of ceftriaxone and that 200 milligram of hydrocortisone will have the same concentration. Then that's the time you're going to administer the drug to the patient. Make sure you remove any air bubble. You put the cap back into the syringe. Then what you do, you get a tourniquet, you apply it into the patient's hand. You get an alcohol swabs. Make sure you clean the vein first. You clean the vein first, then you allow it to dry for some time. Make sure you change the needle with a fresh 23rd gauge needle. Make sure you attach and secure the needle into the syringe. You remove the cap of the needle. So make sure whenever you administer the drug, ensure that you have followed the 8 rights of drug administration. That is the right patient, right drug, right route, right dose, right time, the right reason, and the right documentation. Then you make sure you assure the patient that the injection may cause some sharp pain, but it is short-lived. Whenever you are performing IV insertion, make sure you retract back the skin. You insert 15 to 45 degree angle into the vein. Then you apply pressure on the tip of the needle. Then you pull back the plunger. When you see a flashback in the hub of the syringe, you release the tinicle, then you administer the drug. So this is how you are going to perform. Make sure you pull back the plunger to ensure if there is a flashback. I hope you can see there's a flashback. Then make sure you release the tinicle. You administer the drug slowly and safely to the patient. So this is how you are going to combine. Ceftriaxone together with hydrocortisone sodium for injection. When you finish injecting the medication, then you get a cotton wool. You apply pressure on the tip where you have inserted the needle. Then you remove the needle from the vein. You instruct the patient to apply pressure. Then you put the syringe back into the cup and you dispose it into the sharp spin.